All right, welcome. I think we're online now. Welcome to this online talk, first online talk organized at the European Center for Minority Issues. We are a research institute that does research, policy, um, contributions on any issues related to minorities. And today, I'm delighted to welcome you um, to this talk, online panel, which will talk about COVID-19, securitization, implications for minorities, and diversity. I have here with me and would like to welcome distinguished international panel and a very warm welcome to everyone. Today we have with us Fernand de Varennes, who is a UN Special Rapporteur on minority issues. Then we have Marta Lukacovic from Furman University in the US. We have Biljana Vankovska from Cyril and Methodius University in Skopje in Macedonia. We have Joao Nunes from University of York. And then we have Nisha Kapoor from University of Warwick. And then as a discussant, we have today with the panel Andrea Carlà from EURAC Institute that also does research on minority issues. Our panelists will deliver their talks and then there will be some time for the audience to answer your questions. You will be able to ask your questions or to post your questions in the Q&A window of this session. And you can post your questions throughout Stani, and you can post your questions throughout the talk, and I will be able to see them. And then our panelists will answer the questions at the end. Stani, who is our communications coordinator, will also be present in the call in the background. So for any technical issues, if you can't hear or if you can't see the panel, please contact Stani directly. You can just post a question and he will be able to engage with that immediately. But without further ado, again, I'm opening this panel today and I will ask Fernand to give his foreword and to tell us a little bit about minorities and the most burning issues under the COVID pandemic.
Thank you very much, Marika. Ladies and gentlemen, distinguished panelists and experts, good morning and good afternoon, everyone. Dobar dan, bonjour tout le monde. First, may I congratulate ECMI and particularly Dr. Marika Giolai, its head for the Conflict and Security Cluster, for this timely discussion on issues which are, well, perhaps not always fully appreciated and understood. The COVID-19 has been characterized as a disease that makes no difference between people's origin, religion, or even color of skin. But unfortunately, that's not completely accurate because of structural and inherent systemic inequality that is arguably also discriminatory in many cases towards certain groups. We have at the global level entire countries, first of all, which have no access to any vaccine. This has been described in fact, just yesterday by the World Health Organization's Director General, Tedros Ghebreyesus, as a travesty. But we now also know that inside many countries, while the virus may be blind to our ethnicity or religion, government measures and policies are not so neutral. And I think this is particularly true in relation to minorities or indigenous peoples who may receive little or no information in their own languages to combat the pandemic, or are subjected to hate speech and accusations of spreading the virus, and also who may face structural and other barriers in accessing vaccines or even hospitals or medical clinics and other healthcare measures. And let's be very clear here. There are minority communities which do not always have access even to water or medical clinics, which means that they are denied the basic tools to protect themselves and their families against the virus. And I think we need to emphasize that there is also an increase in dangerous rhetoric that demonizes the other. And when we're talking about the other, we are actually talking about minorities. This includes anti-Semitism. It includes the blaming of Muslim and other religious minorities in Europe and elsewhere for sometimes spreading the virus. Now, that's, in a sense, the broader context. And within this context, there is unfortunately also the phenomenon of political leaders instrumentalizing the pandemic and scapegoating minorities to advance, well, sometimes to advance other agendas. And one of these is to take advantage of security and other measures to prevent the spread of COVID-19, but also at the same time, unfortunately, in some countries, to impose various restrictions on minorities in a, well, let's again be blunt, in a disproportionate and perhaps biased way. And some would suggest that there is something sinister at play. As you may know, in Bulgaria, Roma communities were sprayed last year with disinfectant from airplanes, from crop dusting airplanes, as the coronavirus cases surge in the country. They were also the only ones, by the way, where this happened. And it happened after one nationalist party leader described the Roma minority as nests of infection. Not very nice. In Slovakia, you had Roma villages that were also the only ones where the army conducted testing. Still in Europe, there were increasing reports of police using excessive force against Roma in particular, or mainly, as they were deployed to enforce lockdowns in communities where the Roma were concentrated. And what we're seeing here is once again, we need to be quite clear. We're seeing a minority which is specifically targeted, and I would suggest in a discriminatory way, by state officials using the pandemic and the security or health measures to address that. Let's be once again clear and concrete. We also had in one Ukrainian city an official instructing police to evict all Roma from the town. The mayor of a village outside Paris called on residents to contact the French government, quote unquote, as soon as you see a caravan circulating. And when he referred to a caravan, he was referring to the Roma minority. And in another country in Europe, state authorities used drones to measure the temperature of entire Roma neighborhoods. And of course, that raises surveillance and privacy concerns. I've received reports of Roma minorities subjected to a cordon sanitaire, that the movements of people within their communities was essentially sealed, rigidly controlled and limited. And essentially their neighborhoods, in some cases, were patrolled by security forces armed with automatic rifles. This is in Europe. So the pandemic is raised as a reason or an excuse to use disproportionate policing methods, mainly against the Roma. and in other minorities, for other minorities also outside of Europe. To name just a few, we've had cases along the same lines involving the Bedouin in Israel and the Dalits in South Asia. So let's be clear, if a bit blunt once again. The same would not happen in majority communities. What we're witnessing is discriminatory, biased, and perhaps even racist treatment of some minorities being targeted and scapegoated by state authorities. Now, finally, there's also another area. There are the state responses to complaints of discrimination and others who are defending human rights, including those of minority. Again, unfortunately, measures enacted in response to COVID-19 are being instrumentalized and used as a justification to silence, target, or harass members of civil society, including human rights defenders and journalists and others, which are reporting on how governments are responding to the COVID, but also reporting on the protection of the human rights of various segments of society, including minorities. And this is, to paraphrase the statement made by the UN Secretary General Antonio Guterres a few weeks ago, this is using the pandemic as a pretext for deploying heavy-handed security responses and emergency measures to crush dissent, to criminalize basic freedoms and the defense of these freedoms, and trying to silence independent reporting and curtailing the activities of non-governmental organizations. We're talking about forms of intimidation and surveillance from those who are criticizing or critiquing the government. So this is the environment we need to name and discuss. The scapegoating, the severe restrictions, and targeted policing that have characterized the experience of the pandemic for those minorities who are most vulnerable and marginalized, including the Roma in Europe and other parts of the world. So I think to address this phenomenon, one needs to name it. And unfortunately, and I hope we will discuss this, there are still observers and even human rights organizations which are refusing to call evil by its name. How can you find a solution if you don't properly identify the problem? And the problem is the conduct of state authorities, which reflects the prejudice, xenophobia, and intolerance of the majority that actually targets minorities such as the Roma. And until and unless you acknowledge this, we're mainly window dressing and not taking steps to ensure the human rights of minorities are fully and equally protected in accessing health information in their own languages, in accessing vaccines, and not being subjected in discriminatory ways to security and other measures, as unfortunately appears to be occurring in Europe. I'm very much looking forward to the discussions we will be having around these points and issues. Merci. Thank you.
Thank you very much for this introduction. And it is indeed all these problems and issues that you just mentioned, which are resulting clearly in securitization of minorities in different minority communities, and something that is of grave concern to human rights groups, to researchers, scholars, and experts, which is the main reason for organizing this talk. So without further ado, I pass the floor now to Joao Nunes for his presentation and contribution to this discussion. Thank you.
Hello, everyone. Thank you, Marika. Thank you for this invitation, and also for the European Center for Minority Issues for this kind invitation to be here. It's a great pleasure. I want to talk about securitization in particular. Has already been mentioned here. Security and securitization, they're not necessarily the same. I want to talk a little bit about that. But mainly what I want to focus is on the role of securitization in regards to COVID-19 and its implications for diversity and minority issues. I want to do three things in my presentation. So first, I want to discuss the meaning of securitization, and then I want to say a little bit where I think we are with the securitization of COVID-19. And finally, I want to reflect a little bit on what I think we need regarding the response to the pandemic. So securitization, the meaning of securitization, I think when we talk about it's simply the securitization and its implications for minority rights, I think it's important to be precise and rigorous about what we mean about securitization. So securitization broadly, it's about the invocation of an existential threat, demanding extraordinary measures. So this is what in the literature, what the literature presents as the meaning of securitization. You need to have an actor invoking existential threats to a society or to a given group or to a nation state or to a region, etc. And importantly, you need to have the necessity of extraordinary measures. So this means that securitization leads normally to two pathways. One in which there are exceptions to existing rules. So it is deemed that existing rules, the normal procedures are not sufficient to address this existential threat. Therefore, we need exceptions to existing rules. And very often these exceptions are already enshrined in law. The second possibility is when the rules themselves do not work or are not efficacious to deal with this issue, thus demanding a change of rules. So securitization can lead either to the exceptions to the rule or to a change in rules. Both of them can happen, again, through legislative and democratic processes. So what I want to argue is that securitization, as I've defined it, is not inherently good or bad, but it is dangerous. It is a political modality for framing issues, for understanding issues such as COVID-19 or migration or minorities or whatever. And it's also a political modality for dealing with issues. So the danger of securitization is that it can take us beyond politics. It can take us beyond normal processes of political deliberation. It can reduce the space for political participation. It can hinder democracy. It can impact upon the procedures for democratic deliberation. It also has one danger, which is the problem of minorities, which we are discussing here. Securitization is an effect of power. It is the result of power, of powerful actors, powerful elites, invoking a certain existential threat. This means that it tends to privilege powerful actors. It tends to privilege elites as they seek to hold sway over an audience, to convince an audience that a certain issue requires these extraordinary measures. Now, while this is not necessarily harmful for minorities in and of itself, it can be very dangerous for minorities because it has the potential to reinforce the views of certain powerful actors. And we know that very often the minorities, such as ethnic minorities, are in vulnerable positions in societies and potentially open the door to abuse. At the same time, securitization has these dangers, but it can also have some benefits. So securitization can be advantageous in some circumstances. For example, in raising awareness of the importance of a certain issue. For example, in breaking political deadlocks when there is no sufficient political will to address issues, or in garnering resources. Finally, securitization can also be a political moment par excellence. It can be a moment in which a recognition of the limits of the current political and socioeconomic order, thus opening the way for the transformation if need be. So to sum up what I've said so far, securitization is not necessarily good or bad, but it is dangerous. It has potential to lead to abuse, which, and here in this context, minorities are particularly vulnerable to such abuses. Now, moving on to the second part of my presentation, where do I think we are in terms of the securitization of COVID-19? And I don't want to speak, Marika just already mentioned the securitization of minorities during COVID-19. I don't want to talk about that. My presentation is not about the securitization of minorities, others can speak about that. They will be better placed and more knowledgeable to do so than me. I want to speak about the securitization of COVID-19 in general, the way in which COVID-19 itself was deemed as an existential threat demanding these extraordinary measures. And we've seen in different countries, different experiences with the securitization. It is not possible to say that it was an overarching global securitization of the issue. Securitization was successful in some cases, and it was not successful in other cases. In the cases where it was successful, securitization resulted in issues such as restriction of movements, restriction of circulation, and in lockdowns, for example, closing down certain businesses or imposing limits on the business operation. So this securitization was framed. We can argue whether there were abuses that were made under these justifications, but this was framed by governments as a way to protect the most vulnerable and as a way to protect the common good. So securitization in this case had the one goal, securitization again of COVID-19, okay, of the pandemic, had the goal of protecting the most vulnerable because it was deemed that what we need is to gain time. We need to ensure that we protect those that are more vulnerable, the older, the people who have comorbidities, etc., so that they can be adequately taken care of by the health systems, so that they can be vaccinated, etc., etc. So the protection of the most vulnerable and the protection of the common good. This is what happened in a lot of countries where securitization was successful. In other countries, securitization was not successful. I'm thinking, for example, of two cases, United States of America and Brazil, which are, curiously or not, the two cases where the death toll is the highest and where the number of cases is the highest. And what you have here is that securitization was opposed using a number of justifications. For example, the idea that we need to uphold freedom first and foremost. The idea that we need to protect the economy first and foremost. This was very clear in, for example, the Brazilian government's response to the pandemic. And all of these justifications, all of these attempts to oppose securitization were obviously mixed with doses of denialism. For example, in both cases that I've talked about, United States under Trump and Brazil under President Bolsonaro. So in both cases, we had two examples of two leaders who denied the severity of the crisis, two leaders who refused to do this, to securitize the disease, and two leaders who openly confronted those in their own nation, such as governors, state leaders, etc., who were actually doing the securitization in the form of restrictions of movement and lockdown. And the result is sadly there for everyone to see. So and if we're talking about minorities, for example, both in Brazil and in the United States, you had indigenous peoples, you had ethnic minorities bearing the brunt of these failed securitizations in the sense that they were targeted, they were bearing the brunt, they were particularly vulnerable to getting ill, they were particularly vulnerable to dying of the disease. So the securitization of COVID-19, again, reinforcing of COVID-19, was positive in curtailing and controlling the public health consequences of the virus. Where it happened, where it was successful, it worked. Where securitization led to restrictions of movement, to lockdowns, it worked. It saved lives. It prevented suffering. In regards to the virus, the business as usual, so the failed securitization led to disaster. However, it is undeniable that COVID-19 has also revealed, as Professor Fernand has already mentioned and Marika has already mentioned, that the COVID-19 has revealed, and in some cases it has exacerbated existing vulnerabilities. There are a number of reasons for this, some of which have already been touched upon. I would say, for example, one of the main reasons that this has happened is because securitization of COVID-19 happened in the context of a neoliberal world order, which is traversed by contradictions and which in the case of, given the rising inequalities, the rising precarity in the workplace, has led to many people being placed in extraordinary difficult circumstances, not only exposed to the virus because they had to work, they couldn't stay home, whether forced to work by their denialist leaders, or whether unable to deal with the consequences of the virus because of failing health systems. A second reason why securitization was contradictory in this case is that it was instrumentalized, but has already been mentioned here, it was instrumentalized by certain leaders to enhance their own power in the name of their own political projects, their individual political projects or their party's political projects. So attacks on minorities fall within this regard, and clampdowns on freedoms and rights. And I'm going to wrap up soon, Marika, thanks. Finally, securitization was contradictory because it happened in the context of a retreat of multilateralism and a crisis of international solidarity, as is witnessed by attacks on the WHO by the US leadership under Trump, as is witnessed by the catastrophic rollout and catastrophically unequal rollout of vaccinations that we're witnessing today. So finally, just to wrap up, for one final minute, what we need, given that securitization seems to have been positive in saving lives and reducing suffering, but highly contradictory in its consequences, what we need is not the desecuritization of COVID-19, but it's embedding the securitization of COVID-19 within a worldview of global health security that is cognizant of inequalities and difference, that speaks to or that seeks to redress vulnerabilities, that privileges the experiences and that puts in the first place the experiences of the most vulnerable, and that sees this as an inherently collective endeavor. And that's it for me. Thanks very much.
Thank you very much, Joao, for this fascinating presentation and for emphasizing that securitization of COVID-19 is not the same as securitization of minorities under COVID-19, and I fully agree with that. And I would just say to that the two securitizations are still interlinked and intertwined in many different ways that I hope we will be discussing here today. And just before I pass the floor on to Biljana as our next speaker, I would just like to remind our attendees of the talk to please use Q&A chat window to post your questions while the speakers are talking, because you can do that. You don't need to wait until the end of everyone's exposés, but just fire your questions at any time. So Biljana, please, the floor is yours.
Thank you. Thank you, Marika. Thank you for your kind invitation. I'm honored to be here, but also I have to be honest and to say that this panel discussion bears a high emotional burden. I'm calling from a country and from a region that is on the top list with death toll. Actually, it feels like as if I'm calling from a mortuary. So it is a very hard time for this country and for the whole region. I wouldn't go into making comparisons into suffering of people because the scope of suffering is so wide that encompasses almost entire societies. So even if I disappoint you to some degree that I won't put so much emphasis on different minorities or these typical minorities issues and situations, it is because the urgency of the moment calls for a different approach. Today is World Health Day, as we all know. The UNICEF said that we are facing a pandemic of inequality. And the World Health Organization issued a statement about worsened inequality in health, in access to health services. It is exactly what is happening in this region. the Balkans, in the stereotype of the general public and even of academia, is a dark place of Europe, a place burdened by war and conflict legacies, with ethnic distrust and divided societies. It is even normal to talk about any issue from this ethnic perspective and from these minority dilemmas perspectives. But actually, we have seen in this last year appearance of many new vulnerable groups. I would not say minorities. It is hard to measure them by percentage or numbers. But for example, at some time, the most marginalized group and most discriminated group was the group of elderly people. It was at the beginning of the pandemic when there was a state of emergency in Macedonia and in many other countries. And only later on, the Constitutional Court brought a verdict that it was a clear discrimination, ageism. Today, we have an opposite situation. Nowadays, the young people are stigmatized, are actually even accused as potential killers or bearers or spreaders of the virus. So the situation is very, very dramatic, very changeable, I would say. But what is a constant, what is something that we always forget to talk about, is something that had been here before the pandemic, is here among us now, and I am afraid will be here if we do not shift the paradigm of a global system, of a global understanding and international relations. So at this point, I would like, and I hope I'm going to do that successfully, to share with you a graffiti that actually gives the essence of my main idea of this presentation. This is a graffiti from Skopje, but it is also to be found in many other cities in Macedonia and elsewhere in the region. It reads, by nationality or by ethnicity, if you prefer, I am poor. This is a response to the general political approach to this region through identity politics. Everything is about identity. Identities are enshrined in our constitutions. After the conflicts we have gone through in Bosnia, in Macedonia, and Kosovo, elsewhere. So this new position, this new view actually puts stress on a class dimension, on a social dimension, because treating the minority issues or divisions in the society as something natural, as something that we should control or try to improve through some reforms, European standards, and so on, reminds me more on a salami tactics. We are not looking at the wider picture, but only targeting one group at a time. And in meantime, we have these leaderships of the states that are kleptocrats. They have pushed these countries into debtocracy. They are unable to provide equality and equal access to anything, to anybody, except for the closer members of their particular party or ethnicity. In the power sharing system, both criteria play important role. So if I'm to talk about what has changed during the last year, everything is the same except that it is worse. And it is worse for a much wider population than before. Because the only change in terms of the securitization policy and desecuritization, or even gaslighting, as I put it in my paper, playing once the virus is horrible and it is a killer and we should all obey the government. And the next day, when it is convenient for the ruling elites, it is nothing, it is something like we can all deal with and proceed with elections, with census, with tourism or whatever is at the agenda at the moment. The next day, there is a different shift of the policy. So no wonder the population is completely confused. It is a roller coaster, psychological, and people distrust the government naturally, but now even more. So it is not even a strange thing to hear that the same conspiracy theories that you could hear in Skopje are popular in the suburbs of London. So the people that felt outcast, marginalized, totally forgotten by the state, all of a sudden become a object of special care, and the state that is back on the scene through its biopolitics measure calls for trust and confidence by the citizens. It is not to be done so easily, I'm afraid. But there is one difference that I can make between the developed Western countries that also use these tactics of securitization and desecuritization and the region I come from, is that the state is back in the West. The state is not back in these weak states in the Balkans or elsewhere in the world. The forces of the market, the belief in the market, in neoliberalism is still very much present here. So no wonder we have in our elites war profiteers. During the time of the most horrible health crisis, they're trying to make profit of vaccines, of purchasing medical equipment or whatever is necessary for the society. So this is the only difference, because why it's happening? Because so far, for far too long, I would say, 2-3 decades, these countries have been object of international state building. They had masters, they had someone to ask in Brussels what they are supposed to do. Now Brussels is busy with itself, the European Union and the member states are busy with themselves, so they actually showed no solidarity at all with this forgotten part of the periphery. So the leaders are free to do whatever they like. There are there is no room for discontent, for opposition, for actually doing our job as intellectuals or scholars in calling for freedom and respect of rule of law or anything of that kind, because there is always this excuse. Actually, COVID-19 is not the root cause of the situation. It is only a catalyst that showed us the world we live in its real ugly face. So let me, I hope, I think I'm probably getting close to my time.
Yeah, you're
Okay,
yeah.
so I will end up here. I was intentionally trying to be provocative and to highlight just some contradictions that I thought maybe is useful to emphasize here. What we need is to change the paradigm, as I said, on a global level and on a national level. We need to, as Thomas Piketty put it, to turn back to the needs of public services, of public health, something that has been forgotten. And let me just stress here that during this time, the process of privatization of health services is still ongoing in some parts of my region. That is, I think, more than discrimination of some minorities. It is really disrespect for humanity, for the population as such. I will stop here and will be happy to answer any questions during the debate. Thank you very much.
Thank you very much, Biljana, and for bringing up the problems and the challenges that the Western Balkans, where I originally come from as well, is dealing with under the pandemic and before the pandemic as well, and also for emphasizing that number of problems that sort of just flared up during the pandemic were there before, such as intersectional inequalities, vulnerability of different types that affected different groups, or for political and societal problems. I will just quickly again remind our audience to post your questions, please, for the panelists, and then I'm very happy to pass the floor on and to welcome Marta, who is our next speaker. The floor is yours.
Thank you very much, Marta. I appreciate it. Okay, I will also share my screen, and if you please would just signal to make sure that everybody can see that just well. Okay, excellent. Well, first of all, thank you to everyone who has taken time from their schedule to listen and engage with our discussion today. My deepest gratitude goes to the team at the European Center for Minority Issues for organizing the event. And I'm also very, very thankful to the previous speakers, because as you will see, a lot of what I talk about reiterates, echoes, and then further expands and gives some illustrations to the points that the excellent speakers who just went before me has already explored, and in such profound and important ways. So as you see, I will discuss those issues, specifically illustrating the points with the cases in Slovakia. So what my presentation will do, first of all, I will clarify some of the definitions, some of the specific terminology that I work with. Then I will move on to bring up some very particular examples of those issues that have been addressed in some of the previous presentations. And then lastly, I will also explore some important generalizations, how Slovakia may serve as an example where we can extract actually useful lessons and build recommendations on how to go in future, how to respond to this ongoing crisis, but also what we can learn. So hopefully in future, when we are dealing with some additional crises that will emerge, we can address them in a little bit better ways. All right. I'm operating with the definition of securitization that Joao explained so well in his previous presentation. So we are talking about securitization as a persuasive political speech in order to assert that there is some type of existential threat to some sort of collective unit, such as a nation, for instance, and extraordinary measures are necessary in order to address this threat. And those extraordinary measures may, for instance, mean limitations on freedoms that otherwise we would consider important and we would uphold. When it comes to the pandemic, in my own research, I have connected theories of framing coming from the field of political communication and theories of securitization, primarily being in security studies, and looked at how when combining these theories, we can see that indeed a securitized frame is usually formed on the level of elites. This would be political elites or medical professionals, elites who are epidemiologists and particularly authorities on that level, who then may frame the pandemic as a security issue. This is then passed on to the media level, because that is how this information is broadcasted to the broader masses, right, or to the public. Now, what can happen is, as this information goes through the cascade, there can be some sort of contestation, or some conspiracy theories might be spread through certain media in order to undermine some of those elite frames that are trying to securitize the issue. Also, as has been already mentioned, securitization in itself is not necessarily bad or good in those terms, but it definitely can be problematic, as well as it can be normally preferable. It can be moral, but in order to achieve just securitization, right, moral, normatively appropriate securitization, it is important to make sure that there is indeed just, or just is reflecting referent object, just cause, so there is a real threat, and that the means, right, so those extraordinary means are appropriate, are just, are proportionate to the situation that is so threatening in that specific context. So when we look at the particular example of Slovakia and the situation in Slovakia, there were some issues that have happened, some problems that have happened on different aspects or different tenets of the securitization that are rather problematic and that are undermining the normative integrity. So one example would be the actual definition of the referent object, right? And the problem of quite frequent articulation of the nation that is to be protected from the infection being defined in either racialized or ethno-nationalist terms, so excluding the Roma population from what would be considered as the Slovak nation. Then there were, of course, and very unfortunately, several structural violations. So the means weren't just in that sense, where there were indeed either policies that were restrictive, that were only targeting Roma, such as labeling the houses with the tape of Roma who were COVID positive, and this wouldn't be happening to any other minority or to the majority population, just to the Roma, or also individual cases of discrimination, but those are not just individual cases as bad apples, but they keep on repeating. So they are also very interconnected to the different structural issues. Some instances that were specifically problematic towards the means as related to Roma population were also actually highlighted even in the international press, such as in the Lancet, that has reflected on the particularly militarized lockdown against different Roma settlements in Slovakia, employment of helicopters and patrolling of the settlements by the army, that were by the government presented as trying to protect the Roma and protect the rest of the population. But once again, this has not been employed against any other group. And of course, this has caused a quite serious stress on the end of Roma population. Why are they being singled out in this specific way? And why just they are being singled out in that specific way, knowing that the virus doesn't discriminate based on somebody's ethnic or racial belonging. Now, also, as has been already mentioned by the previous speakers, the issues are affecting also other vulnerable or marginalized groups. So, for instance, I have examples of the ways in which the means in Slovakia also lacked normative integrity in relationship to other vulnerable populations. So there were several instances of stay-at-home orders that absolutely didn't consider the plight of the homeless people, had no plan for the homeless people, and actually were punishing the homeless people. So on top of being already so susceptible to the risk of infection, they also had to pay fines for not staying at home, which they don't have during the lockdown. Another example of such issues where the policies or lack of access to being able to register for vaccination, which was only possible through the internet. And if you consider homeless people, or if you consider elderly people, many of them don't have access to internet, or even if they don't have enough of the digital literacy to be able to operate these websites, which are frequently not very user-friendly, to be able to register for the vaccination. And again, this was something that was not very well thought through by the authorities who were introducing these measures. So being just yet another illustration of the normative shortcoming of the securitization of COVID-19 in Slovakia. As has been addressed throughout my presentation, but also by the previous speakers, these unfortunate instances in Slovakia, and even further unfortunately, are not just unique to Slovakia, right? But they are representative of a more prevalent issues that are occurring across Europe and also beyond. So I just wanted to highlight certain aspects of those issues that are coming together in this particular context, right? So we have proliferation of far-right ideologies that are excluding ethnic minorities, religious minorities, and a number of other minorities from how they define the collective unit that they care about or that they want to protect, right? There is abuse of social media to further spread those ideologies. Sometimes also politicians who are mainstream or should be mainstream, but nevertheless, they frequently may reach for the similar narratives, for similar rhetoric to get some sort of cheap political points, right? That there is the prejudice and discrimination against the different vulnerable groups, such as Roma, such as elderly, such as homeless people, impoverished people, and other minorities. And then we also see the problems that frequently even those who might be wanting to help them, who really want to, let's say, limit the spread of the infections, but are just so ignorant of the everyday challenges of the marginalized groups, of the different minorities and vulnerable groups, that they don't even consider how they need to set certain measures up in order to actually help those who need the help, particularly in such instances. So again, Slovakia does suffer with some of these issues, but Slovakia is unfortunately not alone when it comes to a number of these sorts of problems. Now, what we are seeing through COVID-19 is just exacerbation of some of the issues, or further proliferation or prolonging of the issues that are already existing and prevalent in the societies, as I have just listed. And what COVID has done, as crises tend to do, is just highlight and make many of the problems more acute or even more painful for those who are being impacted by them. But there are those lessons that we can and should be learning. So first of all, it is very, very important to continue our research, talks like this one, to analyze both positive and negative examples. Unfortunately, today we have to focus more on the negative examples, but I want to remind us, let's also try to learn from the positive examples of the responses. And when it comes to the negative examples, let's see how we can do better as we go further, or as we are responding to some future crises that unfortunately we as society will have to face, because there's no hiding from further problems. So here I'm just going to revisit an idea that we have started with, right? So the normative approach to securitization, and I wanted to outline some recommendations based on the case and the normative shortcomings that I have been able to identify in Slovakia. So here are my particular recommendations. So when it comes to the referent object, we want to be careful about the framing and discourse, and making sure that our definition of us is not excluding our vulnerable compatriots, other citizens of our societies who might be a little bit different than us or who are marginalized in some other ways. We want to make sure that there is the just cause, right? So the explanation of the problem and the way that it is internalized by the population is that the problem is the virus and the infection, not the marginalized groups. They are not the thread that is more likely to spread the disease, for instance, to others. And finally, the policies and measures must also be very sensitive to the different possible shortcomings that can and may unfortunately happen. All right, well, thank you so much for your attention. Here are just some selected references that I've been utilizing. And at this point, I'm excited to engage more or take any questions later on.
Thank you very much, Marta, for this fascinating presentation and for mentioning some very important issues. So I will pass the floor now to Nisha. She had some technical issues before the panel started, and I'm hoping that they're resolved now and that we will be able to hear her.
Can you hear me clearly now?
Yes, we can. So please, the floor is yours.
Okay. I just want to echo what the others have said and just to say thank you, Marika, for the invitation and for organizing this important and timely event. I'm looking forward to engaging in further discussions with everyone. I think that I start from a slightly different position than some of what has just or has already been said, in the sense that I'm not convinced of securitization as being something that can be neutral or sort of objective, and that it can be used badly or for the public good, but that securitization itself is something that is has been developed in the interests of the state, in the interests of well, where I am, for protecting kind of capitalism, whether that be kind of property historically or other forms of the sort of capitalist endeavor. And so I think that one of the things or the position from where I start is that I think that in order to sort of reflect on the securitized state responses that we're seeing in response to COVID-19, it's quite important to situate that within the broader framework of surveillance and securitization that's been in development for some time, becoming ever more entrenched, particularly, as was mentioned, linked to the growth of neoliberalism, and then again, the post 9/11 context with the expansion of counterterrorism policing and governing by emergency. And so, I mean, I think one of the things that we have to kind of question is the normalization of the dominant ways in which most states have responded to COVID-19, which is to use digital surveillance methods in part. And that's, I guess, the area that I'm going to focus on, because it's the area of surveillance that I've been working on mostly, is that the ready availability of digital surveillance technologies and the sort of normalization of those technologies as being the solution, the ready-made solution to a public health crisis, is itself something that we should question or think about critically, in the sense that it's been so readily accepted as the way in which we need to respond to public health problems. So, I mean, I think one of the things that we have seen, and what the others have been talking about, is the way in which the criminal justice system has been used to deal with a public health crisis. And related to that is the sort of development of digital surveillance technologies, which are prolific in contemporary society for our everyday routine behaviors and actions as being the other sort of essential part of how we need to respond to public health issues. So in order to think about the disproportionate targeting of minority groups by COVID security measures, I think we ought to consider how these surveillance solutions that are being used now have actually been cultivated in the first place. And I'd suggest that it's the policing of minority communities, certainly in Britain, which is where most of my research is, but also in places like the US, which have been critical for the development of these digital surveillance technologies and applications that are now being rolled out as part of COVID-19. So, I mean, it's almost kind of with a common sense that governments have turned to big tech corporations and their surveillance assemblages to provide solutions to the healthcare crisis. Those solutions addressing the sort of containment and management and future prevention of a virus have readily embraced the employment of big data and its fusion of biometrics and people's socioeconomic profiles and health histories with, have done that with relatively little resistance, which speaks to the sort of normalization of surveillance. But those technologies, I mean, I think what COVID-19 has done was just said, has acted as a catalyst for change that was already in process for some time. COVID-19 has enabled surveillance capitalists and surveillance big tech corporations to access data of larger publics that have been hitherto off limits, speeding up the merging of multiple but previously distinct data sets and providing an opportunity to eliminate friction in previously difficult data supply operations. So one of the things that's happened in Britain is that companies such as Palantir, which is the big tech data corporation that's US based, that's headed by a guy called Peter Thiel, who was a big Trump supporter and quite very much on the sort of far right of Silicon Valley. And Palantir is a corporation that's been contracted to carry out the immigration contracts, the ICE contracts in the US, as well as immigration contracts in Britain, but was also critical to the development of war on terror surveillance technologies and capabilities that were used both in Iraq and Afghanistan, as well as domestically, is now was a sort of key contractor, a key company that was given or offered its services as part of Britain's response to COVID-19, and offered its services pretty much for free, but for a £1 contract. The contract that they agreed on with the British government was basically to provide, or to try and join up the current NHS, the National Health Service data sets in the UK to synthesize the data that was already being collected to build essentially a COVID-19 data store, so that ostensibly the UK could offer a better response to COVID-19. The personal demographic service, the data set that is used by the NHS and which Palantir have won a contract to develop and to basically perfect in terms of allowing it to join up multiple different database systems, is amongst the most comprehensive sets of personal information that we have in England and Wales. So access to NHS data is access to much bigger things in terms of product development and in terms of artificial intelligence, the development of artificial intelligence products, and in terms of allowing Palantir to develop product for various things. But Palantir has also been contracted in the UK to carry out border security services. So Palantir in Britain's post-Brexit mess of border security is contracted with developing a border flow system, which essentially involves doing customs checks and trying to ensure that different departments are joined up with each other as part of border security services and processes. And so the same company that is now involved with doing NHS data security that is tasked with doing something to improve the sort of public health of communities is also the same company that's very much been involved in the UK in border security, but certainly in the US has also been played a huge part in the immigration and customs enforcement, the separation of children from their parents at borders, for being known as the war on terror secret weapon. And so I think when we're thinking about the disproportionate impact on ethnic minorities or on minorities, the sort of racial impacts of security and securitization, we need to think about the way in which what's happening now in the domain or under the guise of public health, or in the interest of public health, and ostensibly to improve the life of the population or to save populations or certain segments of it, is going hand in, is being done by security regimes or by corporations who have also been tasked with and continue to be tasked with the sort of harder and the necropolitical end of states, the security states functions, which has involved violence and death and exclusion at the border, which has involved kind of the sort of everyday policing that is impacting ethnic minority communities disproportionately when we think about things like stop and search or various forms of policing, and when we think about the counterterrorism, the way in which counterterrorism policing is impacting and does impact minority communities. And just because I will keep this relatively brief, I have a lot more I could say, but I'm happy to kind of discuss this further in the discussion, is that one of the things that we have seen through COVID, through the management of COVID-19, is that while a number of the types of or the models of doing kind of digital surveillance have already been perfected or developed through the granting of state security contracts, which is usually for securitizing or surveilling minority or racially marginalized populations. So those the actual policing of COVID or the management of COVID has had disproportionate impacts on minority communities, as others have been saying in other contexts across Europe as well. So one of the things that's happened in Britain is the passing of the Coronavirus 2020 Act, which is deemed to be one of the most wide-scale and draconian authoritarian pieces of legislation that's been passed in recent history, and has extensively expanded the restrictions on civil liberties and powers, police powers essentially, which includes powers to detain anyone that police believe could be infected with the virus. And there is discussion of potentially infectious people. This language, potentially infectious people, has been written into legislation as the ground and is written in as potential grounds for arresting, for charging, for detaining individuals against their will. And though nobody has been successfully charged under that clause yet, there is possibility that this could be something that becomes a way of policing minority communities in the future. One of the things that we have seen is
sorry,
that...
Nisha, I'm just going to have to ask you to wrap up now?
Yeah, this is the last point that I want to make, which is just that the as well as there being a kind of disproportionate policing of ethnic minorities under COVID legislation, the other forms of surveillance and security powers that were already pre-existing on the books, including stop and search powers, have been extensively and disproportionately used to high degree during the periods of lockdown that we've had so far. So it's not just that surveillance is increasing under the COVID rules and regulations, but that there's been a growth in the use of stop and search powers through the other means that were existing, that were in existence or previously, but through lockdown, Black and Asian male youth in particular have been disproportionately targeted under these measures. So I'll end there.
Thank you very much. And again, before I pass the floor to Andrea for some comments and points and maybe some questions, I also want to ask our audience to keep posting your questions. There are some great questions that I see already. So yes, please use this channel of communication, and then I will pass your questions to the panelists. Thank you, Andrea.
Thanks, Marika, for organizing this panel and inviting me, and thanks to all the speakers. I found myself in a difficult position because this has been a really interesting panel with raised a great variety of issues. And what I'm going to do now, just trying to connect a bit the dots, but really then raise some, I don't know, don't want to take too much time, so raise some general question, somewhat direct specific to some of you, but actually all of you can try to tackle them directly, because I don't have a specific question for one specific speaker, so I think we move faster that way. So there's first a general comment. I see there is some tension in the different presentation between highlighting, which I think is the problem of the pandemic, highlighting structural dynamics on the one hand, and sometimes looking at the political agency, the role of political agency, but I will return to this at the end. So some of the issues that are being highlighted. On one hand is the securitization of the pandemic. Nunes mentioned that really clearly. Health issues have been brought into security domain, but not always. We saw great variety in this. But with this securitization pandemic, we are in a state of exception. Is all the problem of the risk of authoritarian moves that some of you have discussed. On the other hand, these are two different issues. Nunes again really clarified that. Is the securitization of minorities in the sense stigmatization and scapegoating, what we heard from Fernand and Varennes at the beginning, the intro of the discussion. So, and here we can see the pandemic. There's something I think most of you raised, is the day of the pandemic as a mirror. Is a mirror that reflects the problem of human society, and there are different types of problems again, because we are talking about two different, looking at the issues from two different perspectives. One is the problem of structural discrimination and inequalities, which affect specific some minorities. Then we can discuss, we speak about minorities, or we speak about marginalized groups, vulnerable groups. So we bring also the problem of the elderly, the age dimension, which Vankovska has mentioned at one point. But then is a general also problem of the neoliberal system, capitalism. The problem of a capitalist society, privatization of the health system, which has characterized most of countries around the world in the past 20 years or even more. And the pandemic is brought all these issues out. So let me go to some general questions, because I think then we need time to discuss them. As been mentioned, and this may be a reference, but what to Nunes and Professor Lukacovic. So we speak about the securitization of the pandemic as we can see as a just securitization. It's something we can accept because people were dying in the hospital. There were a lot of public hospitals were falling apart. So we need to do something. We need a state of emergency to deal with this. Fine, we can discuss about this, but then the question is, How do we need to find this? The problem is not really securitization, how to find the correct form of securitization. And then the question is, can we legitimate securitization, which is what Professor Kapoor as pointed out. Can we justify securitization? Can we legitimize? Can we contain securitization? Can we contain a state of exception? Or this is actually an oxymoron, this is a contradiction. State of exception cannot be contained. There's always the risk that something bad happens. There's always the risk of a totalitarian move, of discriminatory measure entrenched into securitization. When you have securitization, there's not just securitization because it's always too risky. And coming to Professor Lukacovic, how do your recommendation, I totally agree with them. But are we just talking about an intellectual exercise, or can we put them in practice? How can we put them in practice? So I want to discuss about this. This is one question. The second question is, okay, what will happen next? What is the new tomorrow, the post-pandemic world? What is going to look like? Is this a structural negative dynamics that were put in place by the pandemic, securitization of the pandemic, securitization minority, we are going to remain? Or actually, can we look at the pandemic as a stimulus for social political transformation? Can we use the pandemic in that sense? Since the pandemic has highlighted all these problems of our society, has brought them on the table, all these problems, can we use the pandemic as a stimulus to deal with this enormous problem we have? And then the question is how we do that. How do we address structural inequalities? How do we address structural discrimination? How do we not return as business as usual? It's the problem not just the pandemic, but the context in which the pandemic developed. 4 points, and then I stop my 4 general question. What was this pandemic? Can we look at how do we look at the pandemic? Okay, and I stop right now. Just a second, Marika. Is a moment, is a shock, exogenous shock that changed everything? Or you mentioned both Professor Vankovska and then I think Lukacovic, I think, I don't remember, is a catalyst that reinforces some existing tendencies. But then if we look in this sense, what is the role? So these existing, these structural tendencies were there. There's maybe a question for Professor Kapoor. Then what is the role for political agency in all this? Professor Kapoor highlighted a lot. This is the dynamic we are in. How do we change this dynamic? We know some countries have been different in dealing with the pandemic from others. Some countries' situations have been worse than others. Some countries deal with the pandemic in a better way, in less discriminatory way, in using less surveillance, dealing better. So can we highlight the role of the political agency in this to deal with the pandemic? I also want to final point to conclude. There also been some positive development within the pandemic. Some of you already raised. I hear, for example, have used a lot of people. Refugees don't need to be anymore stay on the street in line to get papers because everything is online now. I heard mentioning this from the UN representative for refugees. Now I don't remember specifically their name. So there's been something positive in this during this pandemic. And I stop here because I don't think we have much more time to discussion, if I'm correct.
Thank you very much, Andrea. These are very important points that you raised, and actually you asked some questions that I was hoping to ask myself, but I'm not going to abuse my position as a host of this panel. Now, I will shortly pass the floor to the panelists to answer some of the questions you raised. But in the meantime, I just want to add one question from the floor, from the audience, which is initially for Biljana, but I think it can be also expanded for other panelists as well. And somebody's asking, do you have a feeling that the Macedonian government has been securitizing minority groups in the country because of COVID-19? And I think this ties with partly what Andrea was asking as well. And I think we can ask question whether the governments are securitizing minority groups or vulnerable and marginalized people in any country because of COVID or for the other reasons as Andrea discussed. So I'm just going to pass the floor. And in the meantime, if I can kindly ask the panelists to please look at the questions and You can also just type your answer to the audience in the meantime, because I don't think we will have time to answer all of them today, but it would be certainly great if you can at least send a little message to the attendee of our great panel today. So I'm going to pass the floor to Joao first.
Okay, thank you. Very quickly, just to respond, Andrea, thank you for your for the points you've raised. I'm going to try to kind of very briefly address some of them. You asked whether the pandemic should be considered an exogenous shock or a catalyst. Well, actually, that is not an exogenous shock. I think it's an endogenous shock. It's a result of the contradictions of capitalism. This is a political problem. This is not simply a problem that stems from a biological or a kind of a natural disaster happening upon humanity. This was a political problem. We as a humanity, we were rendered vulnerable by the way in which our societies are organized, by the way in which our economies are organized. So in a way, this crisis, the COVID-19 crisis, reveals the contradictions of neoliberal capitalism. So I would consider this to be an endogenous problem. And this kind of ties to your question about what happens next. Will this be a stimulus for change, or will this just continue to exacerbate our kind of the negative tendencies that we've highlighted here today? Well, it depends on how we conceive the problem. A lot of people seem to want a return to business as usual. I think that would be the worst mistake, because the business as usual is a continued discrimination of minorities. The business as usual is vulnerabilization and precarization of people. Business as usual is the climate emergency. So we need to rethink and fundamentally rethink the way in which our society is organized and the way in which economy is organized. Obviously, I know better said than done, but or easier said than done. But you know, this is where I think we should go next. This should be or could be a stimulus for change, but we need to see it as it is, a problem of global capitalism. Just very quickly addressing one of the questions that was raised by one of the participants in our forum, an anonymous participant. So I don't have a name here, and this person asked, where do you draw the line between a populist discourse or policy practice led by populist government leaders, particularly right-wing conservative populism? Well, actually, if you look at it, two of the leaders who have mostly resisted the securitization of COVID-19 are right-wing populists. I'm talking about Donald Trump and Jair Bolsonaro in Brazil. These are two right-wing conservative populist leaders who have resisted securitization. So it is not clear-cut that securitization is a strategy of the right and a strategy of conservative populists. It can be, in some cases it is, definitely, but in the case of the securitization of COVID-19 specifically, these leaders, in the name of neoliberalism, in the name of their own political interests, their own political survival, they resisted securitization. So there is no intrinsic link between securitization, I don't think, and right-wing conservative populism, because ultimately populists are interested in making calculations to guarantee their own survival. In some cases, they will securitize. In other cases, they will not securitize. It depends on what they see as the greatest advantage for themselves.
Thank you. I was writing that down. Thank you very much, Joao, and thank you for picking up that question, because I was actually going to ask that as well. So next, I will pass the floor on to Biljana.
Thank you. Here are a few questions actually addressed to me. I'll try to respond quickly. Macedonia has been in a very specific situation, and maybe it's not a typical Balkan country to talk about through these lenses of securitization, desecuritization, because of the specific regional problems related to the Macedonian identity, the blockade in the European Union first by Greece, that was resolved allegedly, but now with Bulgaria. So it creates a certain dynamics of internal clashes of groups, of ethnic groups, and we can talk here more about ethnic security dilemma rather than about securitization of minorities or ethnic groups. The Macedonian government have been busy this last year with elections, parliamentary elections, and with census. We were supposed to have census these days, and actually due to the pressure from the public and the increasingly high death toll, it was stopped in the last minute actually. So in this binational state where there is a power sharing model between the ethnic Macedonians and ethnic Albanians, all the other smaller minority groups, 10%, I'm talking about ethnic minorities, of course, are somehow all the time overshadowed. They are all the time somewhere on the margins. They have never have a say in the political decision making or anything important in the country. So it was this year where they were really pushed aside as something unimportant. Of course, there were and there are incidents of clear, overt discrimination, hate speech, especially, you know, when the whole situation is so full of fear and paranoia, and people are distancing from one another, even close people and friends fear to get in touch. Then whenever you see someone who is, you know, not dressed well or looks different, so people get even more cautious and distance, and even less prone to give charity or to assist on streets. I'm talking about the beggars, the Roma people are usually to be seen there, for example. So I can't say that they were particularly securitized in this period, but the lockdown policies always dependent on the balance within the coalition government of Macedonian and Albanian parties, and always on the eve of religious events or elections. So anytime there was not a medical reason or medical motivation behind the policy measures, but some kind of bargaining between the two major groups. There was a question about the graffiti, and I'm glad that Eben Friedman asked it. We haven't seen each other for a long time. And I have to stress this particular graffiti that I used as an illustration for my position, that want to point out the class dimension, something that we always forget, trying through this liberal dogma and paradigm, we forget the root cause of inequalities in the society. That graffiti is from the colored revolution, from the colorful revolution. It was made in 2015. So it is not that the members of ethnic majorities reject to see the vulnerabilities of these minorities. To the contrary, the photo shows Roma people digging into these containers of trash in order to survive. And at the same time, the state is wasting hell of a lot of money on luxury, on corruption. And I didn't mention that Macedonia is this last year became member of NATO. And we spent $7 million on medical care and 230 million on American tanks. So you can make a distinction. Where are we and what are the priorities of our leaders? Of course, the securitizing actors were not always the political elites, but also the religious leaders, the leaders of the religious groups. For example, last year, on the eve of Ramazan Bayram event, the head of the Muslim religious community declared the virus dead. It was his appearance on the media and said, I declare the virus dead. It's over. So you can free celebrate with your families. And the government didn't do anything to stop that, to prevent people following the leader of the religious community and so on. So yes, it is a complex story. It is not possible to respond to all these interesting questions. What next? My thoughts go very much to the line of what Joao said. We need a major global reset. We are going to overcome this virus. This world has seen many viruses, and we will probably face new pandemics in the future. But if we don't really shift, move to another page, this will be a Pyrrhic victory and nothing more. And we will go back to normal, which will be disastrous. Thank you.
Thank you very much, Biljana. And now to you, Marta, if you would like to comment on some of the Andrea's points.
Yes, absolutely. And I just want to basically support Joao and Biljana. I absolutely agree with the main points that they have said. And just one thing I would like to add based on Andrea's question is that there can definitely be just securitization. And I think Joao has explained a little bit how that can be done too. And indeed, Andrea is right that there can be abuses, and the abuses are frequent, so we don't want to be blind to it. But the recommendations are not just theoretical. We as a society need to realize that there is a room for progress, and we need to get better. We are not perfect yet, and there is a lot of room for growth, education, and trying to improve what we do. So we just need to be humble and try to improve step by step, and we can indeed reach just securitization and just become better at those things as a society. Thank you.
Thank you very much. And to wrap up our panel and this discussion, I'm passing the floor to Nisha now.
Hi. Yeah, I guess I would just echo what the
We
others
can't,
said.
you're quite, your tone is quite low. We can't hear you very well.
Can you hear me now?
Yeah, but you're still low in volume.
This is the highest volume I have. Can you hear me
Okay.
now?
It's not great. I don't know if the panelists can hear you, but yeah.
I mean, I'll just be brief, which is just to say
that's
that
fine. It's we can hear you.
Yeah, I'll just I guess one of the things I agree with what was said about you know, things have to change. Obviously the pandemic is a crisis, but it brings to the fore things that have been coming for a long time. And there are, I think what we've seen in different ways in various different countries across the world is a kind of fight between those, you know, the sort of sections that will advocate for greater authoritarianism and more kind of far right moves, and those who are trying to push for something different, something more progressive, something more equal. I think one of the biggest shifts that we will see in terms of the ways in which securitization is done is through the biopolitical. So, you know, what's interesting is just the level of the way in which security measures are being enacted, like through, and surveillance is being done on the body, and, you know, really directly in terms of public health and individual health. So at borders, or, you know, so at the beginning when we heard about the Roma communities being sprayed with disinfectant, or whether we think about the way in which border securities work, is now there's an additional dimension to the types of surveillance that have already been well underway in terms of thinking about passports and citizenship, which is now about one's health status. And I guess everybody is, every state is going through this discussion now about COVID passports and vaccine passports as a way, you know, as the sort of threshold for being able to access different services. And I think that this potentially adds another level of exclusion on, you know, an exclusionary mechanism on top of the other mechanisms around citizenship and minority status that we already have in play, and as well as the kinds of exclusions that racial minorities that born in those states face as well. So I think that's the kind of other thing to maybe be aware of.
Okay, thank you very much, Nisha. I think yes, these are also very important points. And in thinking what next, I just wanted to make a final and very brief comment about minority rights and minority protection mechanisms, which seem to be completely overridden by the securitization practices in different states. And I think what we need to, and we haven't touched upon that subject today, but I think what we really need to reflect on is also how the pandemic has allowed states and governments, especially populist governments, to quickly create normative frameworks that allow securitization and to literally bypass all the mechanisms that are otherwise in place to protect the minority communities or vulnerable and marginalized people. And I think this is certainly something that needs to be thought through for the future and for what comes next. And for the end, I would just like to really thank the panel, my guests. I really enjoyed the conversation, and thank you very much for your contribution today. And to our audience, please feel free to reach out to ECMI or to any of our panelists. This discussion is going to be available. The video, the recording is going to be available on ECMI website and on ECMI YouTube channel. These are the issues that I will continue working on in terms of research. So I'm hoping to hear from some of you in the near future, and I'm sure there will be some important points raised again that we didn't discuss today. So again, and just to say, Fernand, he had to leave for another obligation and couldn't stay until the end. But in the meantime, Marta, Joao, Biljana, Nisha and Andrea, thank you very much for your time. And I hope we will be staying in touch and discussing these issues further. Thank you.